about your period dates approaching nearby? Do you have to carry or take a lot of painkillers during your periods? Do you feel difficulty while passing stool or urine during your periods? If the answer to any of these questions is yes, you should definitely watch this video. So hello friends, this is your friend Dr. Ushasi Mukherjee. I am a gynecologist practicing at Kolkata, and today I am here to discuss about one of the important cause of painful periods, that is endometriosis, which we face in our clinic. Of pain is a very subjective perception. So is the pain tolerance. There is a very difficult scale to objectively quantify the magnitude of pain one is suffering of, or the magnitude of the disease which is causing the pain. But pain is definitely an alarm towards a disease condition that is happening inside, that is gifted by the nature. So while a mild pain during periods, as we know, is often normal, a pain which is often keeping us away from doing our regular activities, the activities which we often enjoy, or making us to rush to the emergencies or the medicine shops to seek treatment for that, is definitely a concern for which we should react immediately. One of such conditions is endometriosis. What is endometriosis? The word endometrium means the inner lining of the uterus. So endometriosis is a condition in which the inner lining of the uterus from which periods occur is found at the aberrant places elsewhere in the abdomen where it should not be. It could be over the fallopian tubes, over the ovaries, above the peritoneum, on the different organs even, like the intestines, the urinary bladder, or the rectum from where we pass the stool. Now what is the problem with that? The inner lining of the uterus as it is formed is sensitive towards hormones. So it has got an inherent tendency to produce menstrual bleeding at a regular interval, what we perceive at each month. So what happens that when the next time our periods happen, this aberrant endometrium, which is deposited at the different parts of the abdomen, as I already discussed, have a tendency towards bleeding during each and every cycles. So these blood gets organized over those areas and form the different endometriotic spots or the cysts. Now what is the problem with that? This causes inflammation, and since the menstrual blood is sticky and altered, the other organs adhere or stick to that, causing severe pain while the stool or urine passes through the guts or the bladder. So we see that there is extreme painful period happen in some of the women and make them really uncomfortable during the periods. And if we take a closer look, we see that the condition worsens day by day or by the different cycles as they progress. So what is the cause of endometriosis? The cause is multifactorial. Exact cause is not known. Maybe certain genetic or familial conditions along with some environmental factors like inflammatory food or the sedentary lifestyle of modern days, blah blah. So what is the treatment or cure of this endometriosis? Since the cause is the periods, unfortunately the tendency of having painful periods will continue throughout the reproductive life of a woman, from the menarche to the menopause, off and on, and goes away only when the period stops or the menopause comes. So is this an end to life? Is this a condition which has got no remedy? Absolutely not. There are medical as well as surgical treatment options to symptomatically correct the consequence, to give symptomatic relief to the excessive pain as well as to its consequences like adhesions to the fallopian tube or the future fertility issues because of the kinking of the fallopian tubes because of adhesion. So here comes the story of one of my patients, Sahiti Dash, a little girl who came from her college during the evening clinic in a lot of distress asking for help due to excessive pain during the period. From her typical history of painful periods along with the other symptoms and associated with clinical examination and certain investigations like ultrasonography, we diagnosed her to have endometriosis with endometriotic cyst. So, based upon the recent guidelines, she was offered different treatment options. One of them is medical, other is surgical. We humbly accepted the fact that while medicines can give symptomatic relief for a while, there is a good chance of recurrence of the symptoms while the medicines are discontinued. And we also gave her the options of surgery, explaining the pros and cons that the disease unfortunately has got a chance of recurrence throughout our reproductive period. While the medicines can suppress the progression of the disease, it cannot completely eradicate the cysts when they are present. So the options are either to stop her periods and wait for the cyst to reduce in size or the symptoms to be gone, or to clear the cysts laparoscopically and then maintain the remission with or without the medicines depending upon her symptoms after her post-operative recovery. But she said that she had had enough of the medicines and wanted an immediate life because her exams was nearing by. We honored her request and hence prepared her for a laparoscopic surgery to clear out all the adhesions due to the endometriosis and also to clear the cyst to give her relief. The operation went as per expectation and the next day only she was discharged. And when she came for 2 follow-ups, she came with a smile which we had seen never before, and the rest of the story, it's better you hear from herself. Over to Tahiti. Thank you.
Hi, my name is Tahiti Das and I was suffering from endometriosis. I have shown a lot of doctors and no one was even able to understand what I'm going through. But after meeting ma'am, I felt like God really exists. She has done what no one could do. She understood what no one can. Even my parents at certain point of time couldn't understand my pain, but she did. She understood every problem and she made me alright. Like I had an operation under her and even just after one day I feel much better than what I used to. Thank you, ma'am.
Thank you.
Hi, I am Dr. Ushasi Mukherjee. I am a consultant gynecologist. I deal with the infertility, laparoscopy and high-risk pregnancy cases, vaginal delivery and the cesarean section.